but well, good morning, everyone, and welcome to our Coffee and Conversation, the first one of 2023. It's been, gosh, I don't know, 2 months since we've met, and it's a beautiful South Padre Island Chamber kind of day, don't you think?
Yeah.
Actually, I think it's kind of nice. Anyway, so Happy New Year to everyone, and hope your holidays were filled with joy and business, and hope your new year is prosperous. And so I just wanted to tell you one thing important that's coming up. On January 31st, on a Tuesday, we are having our first quarterly luncheon of the year. And we are going to be having our speaker, his name is Glenn Hammer, and he is from the Texas Association of Business. So I don't know if you're familiar with that. If you are a business owner, you need to join them because they really they do a lot of work for particularly small businesses in Texas. They have very good information now that the legislature is meeting again, which I think they just started on Monday. There's already, I don't know, like 3,000 bills that have been filed. So they are the ones that keep track of every single bill, no matter how small or how big, that affects businesses. And as we know, most of us as business owners and managers, we don't have time to keep up with that stuff. And the Chamber, this meeting today is sponsored by the Government Affairs Committee. And we have 12 members of that committee, and we have already we're working on our legislative agenda, and we keep up with those things, but even we can't keep up as good of those things as the Texas Association of Business does, because they're there in Austin, and that's their full-time job. So Glenn will be coming to speak about what's going on in Austin, how it affects our businesses, our communities, and it's going to be very good, so I hope you all will come. And as I said, if you're not a member, just Google it. Membership is very inexpensive, and as a business owner, it's very helpful. So hope you can join us. You can go online and get your tickets or call the Chamber, and we will help you with that. I think that's about the only thing that we really have coming up. We will be doing 12 at 12 next month. 12 at 12 is an hour and a half long. It's during lunch. Lunch is on us at the Chamber. We take 10 people at a time. We will meet with you, teach you. If you're a Chamber, who is not a Chamber member? Beverly? You got him? That was a trick. You will be by the end of the day. As a Chamber member, you pay dues. I mean, you pay an annual fee. So why not get your money's worth? I mean, sign up and pay your money and then you don't get anything out of it. We have a lot to offer and a lot of advantages and benefits for being a member. So what 12 at 12 does is we'll sit down with you and go over all of the benefits of being a Chamber member and get you involved and help you to get your money's worth out of your membership. So if you are interested in the next 12 at 12, you can go to our website, our website, and click on it, and it will take you in, and you can sign up for that. It's free, and lunch is on us. So if you sign up for it, do not eat before you come, because then I will eat what you don't eat. And all of us know we probably gained a couple of pounds over the holidays. Well, maybe not Pippa, but most of us have. Okay, I digress. I want to introduce Dr. Joe Ybarra. I'm sure all of you know Dr. Joe. He's been around for a long time, and he has been working diligently to bring improved health care to our community, which we all need. So without further ado, I would like to hand this over to Joe.
What was I supposed to talk about?
The new causeway.
You told me it was going to be a lecture on chaos theory.
Oh, there you go. Okay.
So thank you guys for being here. I look around and I see my neighbors, and I think of Van, who was the mayor when I moved to the island in 1992. Thank you so much for serving us at our EMS. say, Island's my home. Okay? And one of the newest residents on South Padre Island is my daughter, Lucia, who's 5 months old today. So, that's crazy, right? But we love the island, and I love the island. And so I've been in a position for 37 years. I call myself postgraduate year 37 because I'm still learning every single day. I love medicine. I love being on the front lines and, walking in to see a patient and understanding what they're for. But being an EMS medical director here on the island, I realized that I could have a bigger effect by doing big things, like writing a bill. I'm also a lobbyist, so I'll be in Austin supporting a bill that I have going through. I wrote the bill for independent freestanding ERs in 2007, and it passed in 2009. So all these freestanding ERs that have gone up, from that bill. But my passion right now is to provide healthcare on South Padre Island. As EMS medical director, every single day I see people leaving the island, and people moving off the island. Donald Pearl and I, EDC executive director, have studied why people leave. And George Blanc, where are you, George? Is George here?
I'm not here.
Oh, okay. Well, he had a Island Matters report about healthcare on the island. At one point in 2018, I said, I got to do something about this. So I bought a piece of land from David Suiza, and that was about the time that President Trump did this Opportunity Zone proclamation. And so I went to an Opportunity Zone conference and took somebody with me, a consultant, and he helped me find somebody that would be willing to invest to build a hospital. Sorry.
You're just getting further and further away.
If my wife was here, she'd be doing that. She'd also be telling me. Anyway, long story short, we raised $41 million for a hospital, Opportunity Zone Fund. And then the pandemic hit and things kind of stalled a little bit. And then there was the question of should we be a private hospital completely funded by private investors, or should we be a public hospital, critical access hospital? So we did some consultation with a person in Catering Island because they have sort of the nearest type of community that we have. And Jason Brink came and he spoke with us about what he did on Catering Island in a similar situation, and they were really phenomenal. Unfortunately, my investors didn't like the idea of doing a public hospital because of something to do with their investment. So at this point, we're stalled, trying to decide, do we do privately owned, or do we do a public, we're a rural area, so we qualify for a critical access hospital. So that's where we're at now with the private situation. Our money has dwindled. A lot of our Opportunity Zone investors have gone to another Opportunity Zone, so we have probably less than $20 million now for a hospital. But that's still something. Now, I particularly am more in favor of the public option because after talking with Jason, he says that it makes more sense as we're in a rural community and there's more options for care, charity care, etc. So I'm looking into that very closely with some consultants to try to get my investors to reconsider. The other option, so we have the private option, we have the public option, and then the third option is to reconsider hospital affiliation. I've gone to Tenet, I've gone to HCA, and recently again I've gone to Prime Healthcare. And thank you, I don't know who's here representing other hospitals. Thank you for Valley Baptist or Valley Regional, because you guys do incredible things for our patients. Now, Prime Healthcare has new leadership, and one of the leaders is Wes Robinson, sitting right here. He's been gracious enough to come to join us. Thank you, guys. And they're very interested in sort of going out into communities and sort of building bridges. So we're in discussions right now about some type of affiliation. And regardless of where you've been into a hospital, they're all great hospitals and they all have great physicians. But right now, the clinic across the street, my clinic is a population health clinic. I opened it to serve the community, and I really want to keep it open 24 hours. I want it to be a 24-hour facility so that our visitors and our residents will have access to care. I also want to bring consultants in. I want to bring cardiologists. I want to bring GI doctors. I want to bring endocrinologists, because it's just, we have space for them and we have patients that are in need. So that's sort of the vision for moving forward, is to have consultants come in and to open it 24 hours. The other aspect is our ambulances. Ozzy, we have 2 ambulances, right? 3, 4. Okay. Many times they're all off the island. They're in parking lots waiting to offload patients. So sometimes, we don't have coverage. We don't have coverage on the island. So there's a program that CMS started called ET3. And the ET3 allows low acuity patients to go to urgent cares. So if we created an ET3 urgent care 24-hour center across the street, our ambulances could offload minor emergencies, ones that didn't really need the hospital. So we're pushing toward that end so that our ambulances don't have to be away for 2 hours. So that's sort of what we're doing right now. And Wes Robinson, can you come up and say a couple things? He's new administration. He's the chief nursing officer at Harlingen Medical Center, and also the liaison for EMS. Thanks.
Hi, my name is Wes Robinson, and I'm a actual South Padre Island resident. So my spouse and I, we moved here. I worked for another healthcare system in McAllen, and we lived here on the island during kind of the height of COVID. So we were pulled away for 2 years, actually to New Mexico, and the opportunity came back to return and to work for Harlingen Medical Center. And so I've been there just a few months now, and there's a lot of really good things happening. I think lots of times when people think of Harlingen Medical Center, they think of kind of more boutique style hospital. It's smaller, but we're fully staffed. Every bed is staffed. There are travel nurses there. We're really creating a culture that is community focused. And part of that community focus is finding ways that we can get to areas, especially Cameron County, that are perhaps more rural or who are considered rural. It's funny. Everyone thinks we're this little sleepy island, but you get 8-10 million visitors a year. This is a very, very busy place. And I tend to say Andrews by the Sea in Port Isabel. And, there's a number, every year we see it, where someone is leaving the church, they're moving up to Harlingen or to McAllen because their healthcare needs can't be met here. We see that there's a number of winter Texans who are not choosing South Padre Island because of the drive to healthcare. And so I think there are a lot of options. We are really looking at what are those options, how can we expand healthcare. I personally, since I live here, am selfishly looking, of course, at the island itself. But you get to Port Isabel, Los Fresnos, there's plenty of population and plenty of need for us to get creative and to find some ways to bring healthcare close to home. And you have a great partner. It's one thing for a company to want to expand, want to make money, want to do those things. But really, it's the people who care who drive that investment and drive that investment into communities. And so, Dr. Joe, you guys have a wonderful partner. And I'm glad I got to meet him, and I'm glad that I'm an island resident, get to live here. And I know the HMC is a member of the chamber, but we probably haven't had great representation, so you'll be seeing more of me. But one thing I can do now is I'll make sure the chamber can get my information out. If you're looking for certain specialists, if you're at Harlingen Medical Center having issues, give me my cell phone number, feel free to call me, give me a text, and we'll take care of that. Okay? So I know she's like, give me your cell phone number. That's dangerous. No, but
Call me.
we are a community. We need to look out for each other, and really researching those options. How can we bring care close by?
Great, thank you.
Appreciate it. Is there anyone in another hospital represented here? Maybe equal time to. It takes a village to solve problems. When you have kids, it's good to just have family members and people in the city that help you out when everything's happening. But this thing about bringing healthcare to the island has been very complex. It's been chaotic, and I'm a very spiritual person. So even though I'm very evidence-based and scientific, I pray, and I say, God, help me figure this out, because the people I love are hurt and ill and injured. And so whatever it takes, I'm your servant, I'm going to surrender to you. Whatever you want me to do, I want to do it. And so I've used whatever resources I've had to try to do that. And I don't give up, okay? I'm running my 59th full marathon this Sunday. And I climbed Kilimanjaro with my daughters this last summer. And I'm a cancer warrior or survivor, whatever you want to call it. I won't give up on this project. And I'm here, and I just want to tell everybody I'm committed to healthcare. I got a bill, and it's a population health bill, and essentially it encourages municipalities to embrace the whole population, like I have on South Padre Island, and try to improve the population health metrics. We're at 19.7% GDP in the United States for healthcare. That means 20% of our dollars go to healthcare. And yet, the metrics for healthcare, obesity, longevity, infant mortality, chronic disease management, we're like in the middle of the pack for industrialized countries, and that's not good. So, I have two mission statements for myself. If you've heard the podcast that I put out, you'll know this. My first mission statement is to optimize the lives of the people I love, okay? My family, but also the extension of love to my patients and my island family. My second mission statement is to heal healthcare. It's like boiling the ocean, right? But, one person can do it. One person can make a change, okay? I love this story about the little boy on the beach. And there's a bunch of starfish that have, come up shore. Some of you have already heard the story. And the little boy's throwing the starfish back into the ocean. And this man comes along and says, "Look at all these starfish. It'll never make a difference." And he got one up and he threw it back in the ocean. He said, "I just did." So I try to teach my kids, you can be the change. Be the change, and do big things, And so I just want to let everybody know I'm really trying. Fortunately, I have resources, but it takes a village. So if anybody has ideas or connections, or especially on a public option, I would really like to hear this. I had a dinner with somebody that's not here last night, and he said, Joe, get the city involved. Make it part of the city thing. And maybe, but it takes all of us to try to make these kind of changes. So thank you so much for letting me talk, and Peggy, thanks for being my mayor when I first came. That was one of the reasons I came here. And I left my cards here and a little kind of summary of the presentation. If y'all are interested, my cell number's on there. So, and know that we're 24/7. We'll come to you. Okay, we have a mobile kind of model where if you're sick at home and you need us, my cell number is on the sign. Call me anytime. Really. Okay?
Thank you.
Thank you so much.
Does anybody have any questions that they'd like to ask him?
Please, yes, ma'am.
Do you have any sort of a time frame in mind as to when you might might have a facility across the street, the 24 hours wouldn't be consultants?
Tomorrow. Right, Wes? Put him on the spot. Call me and we'll get whatever you need, there right away, okay? Or I'll figure it out for you. Anybody else?
I have a question. So you said something, you said you had
So you said you had a population health bill.
Yes.
Is there a bill that has been brought forward?
Yes.
And can you tell us about that?
My bill is House Bill 3161. It has to do with population health, and for those reasons that I mentioned about the metrics. And it essentially has community paramedics as individuals that can, with a position or with an EMS agency, go into the community and help people with their chronic disease management. Come to your breakfast table and say, okay, this diabetic medicine is doing this, and let's take a look at your refrigerator and see what you're eating lately. Very much focused on lifestyle. EMS agencies are already doing this. Harlingen, Brownsville, Wesco, Raymondville, EMS agencies. The problem is they're not funded. They don't have a funding mechanism. So I work with other leaders in EMS, and it's hard to fund these. They usually have a grant or some kind of debt, but then they run out of money. And so the paramedics that choose to be community paramedics can't, they don't get funded for doing what they do. They also are very into preventing readmissions to the hospital, which the hospitals like a lot because they don't get paid for readmission within a certain number of days. And so this bill fixes a lot of those things. The other thing is that it allows community paramedicine programs at community health centers, rural health clinics, and individual physicians that are family practice oriented for population health like I am, to have paramedics that go out into the community and help handle healthcare issues, specifically to target those population health metrics. 3 years ago, right before the pandemic started, in February 2020, I did EDC funded a community health needs assessment for the island. So we got data on how many diabetics there were, how many people with hypertension. So for the last 3 years, we've been focused on trying to help everybody in that database improve their health, including lifestyle changes. So that my bill kind of covers all of that. It's House Bill 3161. Any other questions?
Anybody else have any other questions? Okay, well, Dr. Joe, thank you for being here. And Wes, thank you for taking, you didn't have to go far. There you go. I didn't know you lived on the island. And I got both your cell phone numbers. I got this really bad pain in my back, and on my leg. There you go. Look, he's already taken care of me.
Thank you.
The chamber will try to, Joe, if we can keep up with what's going on so that we can let our members know if there is a change and this bill that you're talking about or any others, if you could give that information to us, we can certainly, support that on our legislative agenda. So let us know about that.
I let someone earlier, and someone was on record. I have a podcast that I
The teacher paid attention to me.
Yes.
I need a picture.
I don't guess so. I think they must have had somewhere to go. So he's left cards up here and then also some more information that he may have not covered today. I was hoping he was going to tell us we're putting him in the hospital tomorrow, but we'll keep up with it. Well, thank you all for coming, and hopefully we will see you on the 31st. Don't forget our quarterly luncheon with Texas Association of Business. And if you're not a member, see Beverly on the way out. She will help you take care of that. Thank you. Oh, and thank you, Mark. Thank you so much. I mean, he opens up to allows us to come in the morning and want to thank Karla Scimeca for his catering for the muffins. We'll see y'all later.
I'm not very good with that anymore. Pretty much I'm a text girl. 31st, so I need to buy a ticket for that.